This is my patient Aubrey. You can see that her balance was poor before the exam and better after treatment. We're going to do a low back adjustment. We're going to use tongue depressors to assess which side of the TMJ is not working in combination with muscle testing. Then I'm going to adjust her right TMJ. And finally, I'm going to adjust her cervical spine. This is that case study. This is a finger to nose exam. And it measures cerebellar function. And her finger should touch her nose. So it's a little off, right?
Yeah, I missed my nose.
Try this one. So we're going to check the other side. Point your finger. There you go. Tip the finger, tip the nose, nice and slow. And here, once again, she should touch her nose. And she missed again. So she missed on both sides. This is a manual muscle test exam. All the muscles in green are the muscles we're going to test. They should all be strong in this exam. So as we go through Aubrey's test, she's having no ability to resist on these muscle tests. Each different test measures a different muscle. This is the gluteus medius muscles, and they are weak on both sides. This is her left pectoralis. It's weak. And then her right pectoralis, and it's weak. So she's weak on both sides. So with her, because I know her case, we're going to gap her jaw using some tongue depressors. Open. Right. We're going to go back and recheck all her muscles. Push up for me. Go. So this was the exam with Audrey. All her muscles were inhibited. Nothing was strong. Nothing was working. Then I put in those tongue depressors, gapped her jaw, and all of her muscles start to work. So this is how joints that are out of place can cause dysfunction in other locations of the body. Now both glute medians are firing up. Kind of a difference, huh? I'm going to take it out to simply confirm. And all her muscles are weak. Push up. I'm going to put it back in. And this time we're going to put it on one side. We're going to put it on the right side. Push up. And that makes all her muscles strong again. So this is the side that's having dysfunction. Push up. So now both of them are working those muscles. We're going to switch sides and go to the left side. And all her muscles go weak again. So this is telling us that her jaw is playing a role in her body's dysfunction.
I think so.
I'm going to do a little trigger point therapy. Actually, I want you just to open your jaw a little bit there, on the muscles inside her mouth. Let's help loosen them up. And then I'm going to adjust that right jaw. Close, open, close, and open for me. There, you got it from two angles. I'm going to go back and recheck the muscles without the tongue depressors in. Perfect. Push out. Okay, well that's helpful. And remember, these muscles weren't working last time, and now they're working. Wonderful. And this is what we want. Okay. I like. I'm going to have you tuck here. I'm going to give her a little thoracic adjustment. Glute towards me. All right, up you come. Let's go get you to walk in the wall. What I like to do with my patients is have them walk after treatment, because I want to see when they get back on the table and we redo our exam what impacts it had upon their muscles. So her balance is off, which tells me she still has things that are out of place. So we're going to do a little trigger point work, a little massage on her upper erector spinae muscles. This will help her head and her neck move better and have less tension. Here I'm going to adjust her L5. Pull you towards me. Not her sacrum. Okay, a little push. I also want to take a look at her neck. and see what role it's playing in her stress levels actually. And it's around C2, C3 that it's out. That's the area that I'm going to adjust in this video.
Ugh, it hurts. I like that.
Did you get warm?
Warm.
When I touch a patient's hands like that, I want to see if they're perspiring after an adjustment. And if they are, it means they've been out of place for a long time. Aubrey was sweating, which means she's been out of place for a long time. These are the tonic neck reflexes. They're working properly. Okay. Tells me her neck is good. We'll have her walk and move again. Hey, I'm running just a few minutes. Am I running?
Does that hurt?
Do you feel calmer?
Yes.
And we recheck her balance. It's not perfect, but it's better than it was previously. It's not perfect, but it's better. Young lady, thank you for giving me a trust in services. Thank you.
Thank you so much.